Welcome to episode 11 of This Conversation Matters podcast. I'm Dr. Susan Protasio, your host, and today our guest is a millennial who is a California board licensed acupuncturist and has found her calling in healthcare and has been doing acupuncture, and she's going to share her knowledge on acupuncture to us. Because whenever we hear acupuncture, the first thing that comes to our minds are the long needles, the pain when you get poked by it, but I think there's more to it. So we wanted to share that information with you. So let's welcome our guest, Jeannie Chen. Jeannie, welcome back.
Thank you for having me again. Really happy to be here.
Yes. So can you introduce yourself to our audience who haven't seen our episode?
Definitely.
Yeah.
Hi, my name is Jeannie Chen, and I'm licensed acupuncturist in California. And just by the way, the needles are not scary. They are tiny, tiny, tiny.
So acupuncture is classified as a traditional Chinese medicine practice. Can you tell us or share with us what is acupuncture?
Yes. So acupuncture is one of a core modality from traditional Chinese medicine, and I can shorten it as a TCM. So it's not it's not as hard to say. So there's some concepts we want to talk about. So one of the things is that we do believe like there are meridians on the body. As you can see, there are lines on the bodies. We call them meridians. And then there are points on these meridians.
Okay.
They are called acupuncture points.
Okay.
So when we are treating people, we are using this points combination to be precise, to treat different conditions. And acupuncture, the word itself, acu means needles here. Puncture means the actions of piercing. So we do use needles to stimulate points.
Okay. And then there is this also concept of the yin and yang. So what is that yin and yang? Can you discuss it briefly?
Yes. So one of the very important fundamental theory about our health in traditional Chinese medicine, it's yin and yang.
Yeah.
So what happens is that we believe when yin and yang is balanced, it means that you're healthy.
Right.
When yin and yang out of balance, there are disease.
Okay.
So what does this actually mean? What is yin and yang, right? One of the example, if we talk about outside, if I tell you yin is something cool, rest, calm, and then yang is something bright, loud, active, hot. So if I ask you, fire, fire and water, which one do you think is yin, which one is yang?
Okay. It's the yang, the
yang is the fire,
the
right?
fire.
And then yin is the water.
Yeah.
So imagine our body.
Yeah.
So if, for example, I want to be in a certain way, I don't want to be too depressed, not moving.
Yeah.
I don't want to be too active.
You want to balance it.
I want to balance it. So if I'm too active, I'm too much yang. So using acupuncture and other traditional Chinese modality to balance it, we can put you back to this balance in and yang.
So can you tell us how acupuncture works and what medical conditions it can be used for?
So one of the analogy I want to share really quick is that acupuncture points, you can imagine like a computer keyboard, and then our brain is like computer CPU, right? So when we are inputting information, choosing the point stimulated by the needles, your brain reacts to it, and then it will start the body's healing. So that's a layman's terms of how acupuncture work. So what kind of condition we can treat? There are over 50 health conditions we studied so far. But definitely most common one we use is to treat pain. Pain management is a big one in acupuncture. Lower back pain, neck pain, shoulder pain, all kinds of musculoskeletal pain. And also we treat emotions as well. Anxiety, different kind of things, and fibromyalgia, all the autoimmunes. Nowadays, when we are not certain, what kind of treatment they can, they have
because of the chronic pain.
Correct, and usually acupuncture can provide some hope.
And also, I think it can help a certain help in multiple sclerosis, the MS. multiple sclerosis. The
Correct.
MS, yeah.
Correct.
Isn't
Yes. So we are able to manage your symptoms.
Yeah.
So for them, they may encounter, numbness, tingling. They may have pain. They may have depression.
Right.
They may have different. One of my patients told me that they have like MS hug. It means that it feels like someone always press on them,
Right, right.
so they couldn't really breathe. Acupuncture is actually very, very helpful with controlling those symptoms,
Yeah.
so the patient feel themselves again. Yeah.
And then I think, isn't it that when you insert the needle on the trigger point, it kind of stimulate the nerve pathway? Is that how it works? Stimulate the nerve pathway, and then the neurotransmitters are released. How does that work again? Can you
Yes.
explain that part?
Yes, so yes, that's very important.
Yeah.
A little bit scientific now.
Yeah.
So we have something called endorphin in our body, right?
Uh-huh.
You can know it as a natural painkiller.
Right.
It can equals to opioid, but without side effects.
Right.
So there are multiple studies shows that after acupuncture treatment, the endorphin level increase in the body. So that's why it's so effective treating pain, because of this natural painkiller just go up. And also there are multiple studies when you mentioned about neurotransmitter, right?
Right.
Dopamine increase, serotonin
Right.
increase. So that's why we can actually help with patient's mood as well.
Yeah. And then I was looking also, what does when you do that, when you insert the needle on the trigger point, that is stimulation. I read on it, I checked on it, that stimulation leads to several effects. And what I read says it helps in the pain modulation, it balances the autonomic nervous system, leading to rest and relaxation and stress reduction, like what you're saying, right? And it also affects the neurotransmitter, the dopamine and the serotonin, which you mentioned, that plays a key role in the mood of the person. So that's wonderful,
Yes.
with all those things that are being, healed or touched through the process of the acupuncture. So what do you think is the view of Western medicine to acupuncture?
I think, to be very honest with
Yeah.
you, probably long time, probably 20 years ago, when we are not, although acupuncture is already very popular, but we are probably not as familiar with what this is. At that moment, Western medicine probably view it more like a placebo effects. But with more and more study coming in, we do see, when we mention about, we do see the actual changes happen after acupuncture needles input into your body, right? So now and then every single time, almost, to be honest with, every single study you pull out, it's the function, the efficacy is better than placebo.
Okay.
So now Western medicine actually acknowledge that acupuncture works really well with pain management.
Yeah.
So I believe some medical school, they start teaching acupuncture as well.
Oh, that's good.
And a lot of hospitals, they start hiring acupuncturists, especially in oncology department.
Yeah.
So this is something they really like, because we can help them when people are going through chemotherapy, radiotherapy. We can help them to manage side effects.
Oh, that's wonderful. You know, that's wonderful. So, with regards to chronic pain, how effective is acupuncture in treating chronic pain? Because there's a lot of people here in the U.S. with a chronic pain,
In short, very effective.
Yeah. So
thousands years of practice.
Yeah.
Clinical effectiveness is like long-standing record right there, right? But definitely, I want to, instead of quoting different studies for you, I want to give you some clinical example. Maybe it will help you to
understand it and how effective it is.
Exactly.
Okay.
So I have seen patients, multiple,
Okay.
walking into our clinic with walker,
Okay.
lower back pain,
Okay.
too much,
Okay.
cannot walk without anyone help
Helping
them,
them,
or without walker, right?
Yeah. So-
But we're talking about lower back pain. There's no broken bones, nothing like that, okay? After acupuncture treatment, they walk out without walker. They walk out without people's help. But that's because their pain reduced so much. They're able to do that.
They're able to walk or move.
Yeah, and if we want to quantify a little bit in the clinical sense, I do have patients take painkiller almost every single day.
Right.
After acupuncture treatment, they tell me, I don't need painkiller anymore. I just need to come to your clinic once a month to maintain my pain. We're talking about really chronic, chronic pain, over 10 years. So yeah, it's very effective.
So normally, how long is the session? Let's say I'm a patient, I wanted to, try acupuncture. So let's say shoulder pain. So how long is the sessions? Like how many times do I need to come back?
So it depends on your condition, to be very
Okay.
honest, and depends on how early this is. So we talk about coronary pain, but acupuncture is actually also good for acute pain in any type of situation, right? Usually when we're saying when you treat earlier, the effects is better. So your treatments doesn't need to last too long, or you don't need to have too many follow-ups. When we're talking about chronic, it also matters on the underlying condition, right? If I have MS, for example, most likely we're not able to cure MS at this moment, but we can manage it. So we do need multiple treatments.
Right.
Yeah. And
So-
it would be invaluable when you go to clinic, and we do have a
So that
process.
does it last like 6 treatments or 12 treatments, or how does it go? Like, or depending on the assessment?
So it really depends on assessment, but I always tell patients that, to be very honest, 4 to 6 treatment, we know where we are at.
Okay.
We're talking about chronic pain again, because for acute, I can treat with one. Sometimes I can treat with one treatment, no problem.
Just one visit for the
Yes, just one visit.
acupuncture, but
I had a patient, acute pain. She locked her lower back when she was reaching out, and then it just locked.
Yeah.
And then it was so painful. She was walking with a walker. 2 needles, 5 minutes. She's fine.
she's okay.
Never come back. Yeah.
Didn't come back.
yeah, she's fine. Yeah.
That's wonderful. So have you, in your practice, or like in relating with people, have you encountered people who are skeptics of acupuncture?
Yes.
So how do you relate to them? How do you?
I feel like, to be very honest, because this is not very, very familiar medicine to everyone.
Right, right.
So a lot of patients, they have a lot of questions. And then especially when we hear about needles, we're thinking about those big injection needles.
Big long needles.
That's very scary. I always, first thing,
Yeah.
I think, listen. You want to listen to your patients. What's the concern? What's make them feel like, I don't know about this.
Kind of anxious to try acupuncture.
Yeah. So if it's needle, I show them the needle, and I show them. Sometimes I even put the needle on myself. Look, that's not even painful, right?
Yeah.
So we communicate a lot. Usually, my first treatment, I explain everything.
That's good.
If some people want to understand science, I explain science.
Right.
Some people want to understand in the Chinese sense. I explain. So whichever
way that you
they
can
actually want
communicate to them.
exactly.
Yeah.
But I do have someone still be like, I don't know about this, and usually at that point I give them choice.
Yeah.
So as a medical practitioner, we still need to make sure patients got taken care of.
Right.
So I will say that I think your condition can be benefit from this type of specialist. I can write you a referral. Or do you still want to try acupuncture just one time to see how you feel like?
Okay.
We have a saying, it's actually in our oldest acupuncture textbook, believe it or not. They said that if someone truly don't believe in this medicine, do not treat them.
Right.
Because acupuncture, well, last episode we talked about holistic, right?
Right.
Acupuncture is holistic medicine. So we want to treat mind, body, spirit together.
Right.
So if they truly, truly don't believe it, it means that they are kind of against it already. Don't push them.
Because it may not work, or it will not work.
Or even, create some type of side effects, right? They may be fainting on the needles. It could happen, right?
Yeah, that's true.
So don't force them. But usually, to be honest with you, about 99% of people, after you explain to them, they're okay.
Yeah. And then I think the acupuncture, I think it's covered by the health insurance, isn't it?
Yes.
Yeah.
Yes.
And then so the primary care can do a referral to acupuncture, isn't it? That's the way it's done?
So it depends on the insurance plan you have.
Yeah.
A lot of them actually doesn't need extra referral, but most of them are only covering pain condition. Like we mentioned, acupuncture actually treat a lot of different things, right? Even neuropathy, for example, but it's that part is not covered by insurance. But if you have pain, then
it will be covered by insurance,
Exactly.
and probably a little, depending on the plan, if they have a little, out-of-pocket payment or no out-of-pocket, depending on the plan, right?
Correct.
Yeah.
And usually, also depends on the plan. Usually, they may have a limitation of sessions. How many sessions?
Okay, how many?
Yeah.
Yeah, they only cover certain numbers, but that's okay.
It's
At least
okay,
you know
yeah.
they could try it and see if it works. Then
Yeah.
they could proceed with another plan, probably,
Yeah.
right?
And usually, to be honest, at the clinic, I teach patients how to do self-care as well. So you come in to treat with acupuncture. Chinese medicine acupuncture has a lot to do with lifestyles as well, a lot to do with this,
Right.
if we're going to balance yin and yang.
Yeah.
For example, if I'm sitting all day, that's not balancing yin and yang, right?
Right.
I'm not moving.
Right.
So if I want to balance it to make sure you continue to stay healthy, I always share some knowledge with my patient, teach them something. So after acupuncture treatments, they can take care of themselves as well.
Yeah. So that there's a continuation of treatment, like a maintenance or something, right? So
Correct.
maintain that status that they're getting well.
Correct.
So that's
Correct.
good. So where do you see, because others, like you said, others are not familiar with acupuncture, right? Others have known acupuncture for a while. So where do you see acupuncture in the next few years, or the next 10 years? How do you foresee acupuncture at that time?
I have hope. I do believe with more studies coming out, I have hope that we see the benefit of using acupuncture, which is part of traditional Chinese medicine, and Western medicine together
Yeah.
to really benefit our patients.
Yeah.
I have hope to see that. I see the train going there,
Yeah.
but I do think, like you mentioned about some people know, some people doesn't know.
Right.
We want to share this knowledge.
Right.
And then we want to, that's why I want to shift to
Right,
share
yeah.
with people about this knowledge, because only then I feel like patient equipped with more information, knowledge to
yeah.
take care of themselves.
Right.
Yeah.
And also having the knowledge of at least what is acupuncture, how does it help in chronic pain or acute pain, then it might be a consideration for them. Hey, the medicines I'm taking is not, giving me that much relief, so probably I should consider it. It could come to that point.
Yes, and also maybe before we decided to go, because we call this also conservative treatment, right? So acupuncture, chiropractor, because we don't open you up.
Yeah,
yet.
yeah.
So sometimes we also provide the option for patients to do this kind of treatment, see if they improve before surgery. What I'm trying to say is that in our field, we keep saying that we provide this kind of hope, but you wouldn't know you have this option if you don't know anything about acupuncture.
Right.
So that's why knowledge
that's why
sharing
we're
is
here.
very important. That's
Yeah.
why we're here. Yes.
So, before we wrap up our conversation, is there anything else that you want to share to our audience about acupuncture?
This is great medicine. I feel like at this moment, with our short time
Yeah.
here, we're scratching like
I know.
tiny
I
surface.
know.
I wish I can share more, but I encourage everyone to explore acupuncture and Chinese medicine. After you learn about this, behind it, the theory and the philosophy behind it, you will find it interesting. You can apply to your life as well. So we are talking about the peace, the health in mind, body, spirit. So I welcome everyone to email Dr. Susan to ask her more questions about acupuncture.
So, okay. So thank you so much for sharing your knowledge about acupuncture, at least for people watching us who have, never had an experience or information about acupuncture. I think it opened up a curiosity to say, hey, what is this? And probably I could read it online and research or ask my physician,
Yes.
So it's wonderful. Thank you so much for your presence today and sharing your knowledge. So acupuncture has stood the test of time and has persisted as a mode of healing, blending tradition with, the modern medicine. So I hope, it continues to be that way. And hopefully through this episode, we were able to share information. And like what Jeannie said, there's so much to information in acupuncture, but due to our limited time, we were not able to cover it, but at least we were able to give you an insight of how acupuncture works and how can it help you with your chronic pain or acute pain. So thank you so much. Appreciate you presenting acupuncture,
Thank you. Thank you.
So thank you so much for watching. I hope you gained some information or wisdom from us. So click the subscribe button if you haven't, and I'll see you in the next episode. So take care of yourselves and blessings.